Hi, Sanjiv. Nice to see you this afternoon, and thank you for your time to talk to me about the introduction and the work that the NMC has been doing on developing additional regulation for advanced practice, but specifically thinking about the principles for advanced practice and what that's going to mean for general practice and primary care. I wonder, Sanjiv, if you can just kick us off by telling us a bit about yourself, what your current role or roles are, and how you've worked with advanced practitioners.
Thank you very much indeed, Paula, for inviting me to come and talk to you today on this topic. As you say, I am a GP by background. I've been working as a GP in Barnet for the last 25 years. And in that role, I am both clinically active and am obviously an employer as well as working alongside multi-professional staff in the delivery of patient care at the front line. In addition to all of those, I have also worked in higher education. I'm currently the head of School of Medicine at Anglia Ruskin University and am part of a multi-professional faculty of health and social care. Um, and I'm also a professor of primary care and medical education, which means I undertake research related to the delivery of care in primary care as well. In addition to all of the above, I'm also the chair of a commissioning committee for primary care services in Mid and South Essex. So I have a range of roles, both clinical, academic, commissioning, um, as well as educational.
Thanks, Sanjiv. That's really helpful. And it's really great to talk to you today because some of our earlier research identified some key risks and challenges with advanced practice in primary care and also out of hours urgent care centres. So it'd be really great to have your perspectives and your input today, given your breadth of experience. So I wonder if you can share with us your thoughts around the role of the advanced nurse practitioner within general practice and primary care.
Thank you, Paula. The role I think is an important role. It has been evolving over the last 30 years, and I think it will continue to evolve as the level of acuity of patient need grows and as demand for patient care grows as well. So I think that nurses taking on advanced roles in support of care delivery is really important. But it's also important, I think, to ensure that nurses are equipped with other capabilities that include the ability to lead services and teams and the ability to ask fundamental questions about the nature of service delivery and then to seek answers and make changes both at the front end whilst also influencing commissioning and policy as well. So I do think that the advanced nurse practitioner role in general practice and primary care is absolutely critical. There is a political dimension to this as well, in that the current government has a ambition to transition care in all sorts of ways. One of them is to transition care from secondary into primary care, is to transition care from reactive to preventative healthcare, and to embed technology as a profound and fundamental way patients experience their health and their healthcare needs. So it strikes me as being absolutely pivotal that nurses and particularly advanced nurse practitioners have a key, and in some cases lead the design, experimentation, and delivery of that technology. But beyond that, supporting the kind of sort of missions that the government has over the coming period of time. So I think there's the sort of context around the current role of nurses and nurse practitioners. And then there's the sort of political futuristic dimension that I think plays into this as well. And the final comment I'll make is about the variability of titles, capabilities, and what that means both for employers and also what does it mean for members of the public when it comes to trying to help people understand or convey what an individual may or may not be doing. So, we talk about the public generally has a reasonable understanding about what a general practitioner, medical practitioner does, or they might understand what a primary care dentist does. I'm not sure we've completely yet got an adequate understanding for the public about what an advanced nurse practitioner does in terms of that care delivery.
Yeah, there's some really key things that you've raised there, and I know we'll come back to the public facing definition that we've developed. But yeah, throughout the work that we've done, we've heard loud and clear of the variability and inconsistency, as you say, and also that the public just doesn't understand what their expectations should be of advanced practitioners, whether they're nurses or midwives, in delivering their care. But really critical what you said around kind of the government direction of travel and that move from acute or secondary care into primary care, and the advanced practice workforce needing to grow to be able to support that. So thank you. I wondered specifically, what are your thoughts? And again, thinking about the roles that you have, but what are your thoughts around the NMC's work on developing additional regulation for advanced practice?
Yes, like everything, it has got potential benefits and potential downsides. I think it will bring some consistency. I think it will give a level of credibility to the title and to the role. I think it will make it easier, I hope, for patients to understand what an advanced nurse practitioner is and what they should be capable of doing. I think it will improve the standing and morale of the nursing workforce, and I think it will make it easier for employers to understand what that title is designed to achieve. There are some downsides to it as well, I think, and some of the downsides might include a loss of some flexibility for the manner in which staff are deployed in small business enterprises, which is what general practice surgeries are. But equally, you could argue that there are similar settings like care homes as well, where the need for flexibility in the way the workforce works may be constrained by the definitions that would emerge with an A&P role. There's a risk, I think. There's also, I think, a challenge to thinking a little bit about cost. Inevitably, advanced nurse practitioners will attract a higher rate, or will be expecting a higher rate of pay. Will that generate some economic challenges for primary and community care, which again is delivered very largely on a small business footprint, and really isn't allowed to go into deficit. And I think Aradaz's report from September, October last year was very clear that actually the only part of the health and care sector that actually comes in on budget, on time, every year is general practice. So I think there is a potential issue. I don't think it's large, and I don't think it's insurmountable, but it's one that needs some careful thought and consideration, because that I think will be a challenge. The third is how does a small business unit like a general practice surgery think about advanced nursing practice in the context of its multi-professional workforce? So there is an issue with how does it embed skill mix in the context of essentially a small business? I think there's greater scope to do this kind of work in large teams, which is secondary care really largely. and to a degree in community trust settings. But I can see that there may be potential for some limitation of the ANP role in primary care if the considerations around skill mix are not given some thought.
Yeah, that's really helpful. It's really helpful to hear, some of those challenges, particularly that you're talking about with general practice, and you know we, we're cognizant of the economic challenges across the board, but appreciate your point as kind of small businesses, what that might mean, and also thinking about the skill mix, but the point around kind of loss of flexibility within small businesses again, and thinking about care homes is really important, and something that we need to kind of consider more as we move the work forward. So you'll know that the principles are the first part of a bigger set of deliverables or products that we're going to develop as part of this work. So the principles are the kind of foundation and the baseline, and we've had our principles approved by the NMC Council, and we're planning on launching the principles in early June, so in the first part of June. So it's a bit of a momentous occasion for us, because we've been on this journey to regulation of advanced practice a number of times over the past kind of 25-30 years, as you've identified as well. And we won't deliver additional regulation of advanced practice until we've developed all of those things. So the principles, as I say, will be the foundation, and then we'll go on to develop those standards, those benchmarks, so that professionals, employers, the public will have a really clear idea and understanding of what standard they can expect from nurses and midwives who are practicing at that advanced level, which is really important. We call them in NMC terms standards of proficiency. We've had lots of debate around what we mean by a proficiency, and what NHS England and others in their advanced practice frameworks refer to as capabilities. But I just wonder if I could have your thoughts on the introduction of principles for advanced practice and what that will mean to advanced practitioners who are working in primary care. So I'm thinking about from the point of view of the workforce itself, but also employers as well.
Yeah, I mean, I think from the perspective, certainly from the perspective of the workforce, there's clearly, obviously, some already established programs. So I think about the Centre for Advancing Practice that was set up by Health Education England, and currently sitting with NHS England at the present time. So some of this has already been out there, and I think that a number of my colleagues have been interested in engaging with those standards or those principles. And I think that this is really helpful, because what it does is it provides clarity that actually, if someone did some work with the Centre for Advancing Practice, that's not going to go to waste. Indeed, that actually these principles provide sort of the start of a regulatory recognition for those journeys that our colleagues are going on. So I do welcome the introduction of principles, and particularly from a regulatory perspective. I think one might just need to be a little bit mindful of not creating a rigid architecture of regulation becoming an interference to service innovation. And I think that's sort of something that one will need to keep a close eye on. That actually, rather than preventing the fossilization of that sort of move towards a sort of more a tighter regulatory framework. And second, I think if this is limited to nursing, one of the challenges I think is that actually with a multi-professional workforce, employers will find it challenging to implement something for one particular professional group. But for others, the titles may continue to still be used, but without the regulatory framework to underpin it for them. So the challenge there is that actually I think there's going to be some confusion for employers about terms, conditions, expectations around CPD, etc., that are laid out in the principles, but also what does that mean for other for example, allied health professionals that are working in primary care, or pharmacists or other groups who may not have the same level of regulatory framing and oversight that otherwise nurses might have. So I think employers will find that potentially, especially small businesses and especially challenged small businesses, will find that I think quite both confusing but also difficult to engage with without being clear about what expectations are from employers.
Yeah, no, that's really helpful. I think, one of the things that we've been doing throughout this work is we have a number of different groups that we meet with regularly, and one of those is a joint regulatory group. And actually, it was from that group and the work that we were doing with the 9 other health and care professional regulators that we began to think about what advanced practice kind of meant across the different professions. And we continue to have those conversations, but are really mindful, as you point out, of the potential unintended consequences of nurses and midwives having standards and standards, regulatory standards to work to, but other professionals not having those standards. I think within the development of the principles themselves, we've tried really hard that although our mandate is for nursing and midwifery, that the principles are broadly applicable across all professions. And I think we'll continue to have those conversations around the kind of, multi-professional implications. You also mentioned the Centre for Advancing Practice and the multi-professional advanced practice framework. And again, across the 4 countries, there are different frameworks. So Wales and England are multi-professional, but Northern Ireland and Scotland are for nursing only. We are working closely as well with colleagues from across the 4 countries, but particularly with the Centre for Advancing Practice, because they do have a program of credentialing individuals and credentialing universities who are delivering these programs. So we'll continue to work closely with them. I suppose it is important to say that we have different roles. We, as a professional regulator, have our kind of legislation, and with that comes its own kind of responsibilities, and one of those is public protection. So being mindful of our role, but from what you're saying, I'm understanding that we don't want to stifle that flexibility, that innovation in service delivery as well. So really important points for us, and I think on the multi-professional front, what we're doing here is for nurses and midwives, so the 2 professions we regulate. But even within those 2 professions, advanced practice within nursing has been around for a really long time. But within midwifery, it's much earlier on in its journey, and we've had some challenges around that as we go along. So I think it's really important to continue to have open and honest conversations around these things and continue to kind of manage the challenges. I wondered whether you felt that the principles would, because in our earlier work we heard about the challenges from primary care advanced practitioners working in general practice, and the challenges within their role of their employers understanding the role, of multi-professional colleagues understanding the role, and having the governance in place to support their needs as advanced practitioners. And I guess I'm talking about things like appropriate clinical supervision and support for those roles. I wondered what your thoughts were on whether you think the principles will support general practice to be able to develop some of those governance processes around advanced practice.
The short answer to it is yes. I mean, basically, what the principles do is they provide a scaffold, that they provide a framing for how a small business or a general practice thinks about the support required and oversight of the work of an advanced practitioner. In some senses, that is what a good employer should be doing for all its staff anyway. So what this document does really is reaffirms, reinforces, and encourages employers to re-engage with those broad principles. The challenge comes at the point of implementation, because no one, I think, would disagree that having a descriptor or a set of descriptors for advanced practice is welcome. The challenge then comes is, how does a small business that may be financially challenged actually then take the step of putting in place that additional governance? And I would urge that perhaps some collaboration with the four statutory education bodies may be helpful, and similarly conversations with the commissioning entities across the four nations might be helpful in thinking about how implementation could be supported and delivered. So I think there is potential here for really good stuff to happen, but I think it needs to happen alongside thinking about service and education, and supporting the development of nurses, particularly in primary care, to upskill. I think the other challenge, I would argue, that needs to be considered, and how the principles can help, is what does this mean for things like agenda for change, and for pay and terms and conditions for nurses in primary care. As we know, primary care nursing has largely remained out of the agenda for change framework. So, absent that kind of standardization of terms and conditions of pay, this may be a tool that can help to give, again, some framing and some acknowledgement and recognition. However, the risk is also that actually, in the absence of standardized approaches to terms and conditions of pay, experience of working, that this sits alongside all the other frameworks that are in our establishment. And so I think that the point I'm trying to get at is that I think you do need to move from principles to actually developing a framing, a legislative framing, because otherwise I think I can see that the principles will eventually fizzle away, and in primary and community care, where sort of service and financial pressures mean that employers make decisions that perhaps don't lend themselves towards investing in staff development, or putting in place appropriate mechanisms for supervision, or encouraging team-based learning, etc., etc., etc. So some of the stuff that I think that the principles really tries to drive forward.
Yeah, I think that's really helpful. And yeah, we're absolutely having those conversations with commissioners and with workforce leads across the four countries. And in fact, they've been involved in the development of the principles to make sure that they align to their own country frameworks, but to make sure that they're meeting their needs kind of for now and into the future. And yeah, this is just the start of additional regulations. So, we will go on to develop standards of proficiency. So what nurses and midwives at this level should be able to do, as well as education program standards. So in the future, a nurse or a midwife practicing at an advanced level across the UK will have to undertake a program of education that has been approved by us, as it is with pre-registration nursing and midwifery programs. So it is a package, isn't it? It's the sum of all the parts. But I take your point on particularly on the financial economical challenges of principles for small businesses. I wonder what your thoughts are, and you touched on this earlier in terms of kind of the public understanding the role of advanced practitioners. But as part of this work, we have worked with a public advisory group who've led the development of a public-facing definition for advanced practice. So I wonder what your thoughts are on that public-facing definition. We've actually, within the document itself, got two definitions. So the one is the public-facing one. We've tested that out with members of the public and with charity advocacy groups and various networks. But professionals, as you can imagine, wanted the nuances around uncertainty, managing complexity, dealing with additional risk, and that kind of, level of leadership and autonomy that comes with the role. So I just wondered what your thoughts were on the definitions, particularly the public-facing definition.
Yeah, I mean, I think the definitions are helpful. I think that they start to crystallize the kind of nuance and essence of advanced practice. So I do welcome both the definitions. I think are excellent. I think the public-facing definition is really very good, and I think again it helps. Certainly for me, I would have thought that it would help a member of the public begin to see how the role is unique and distinct in terms of the nature of the work and the kind of sort of skills and capabilities that have been developed. There are clearly going to be some questions about, what is the type of skill, what is the type of education that a nurse has been through to gain that level of proficiency. But that really, I think, comes from the more detailed work that I suspect you will be doing in due course. As a definition, though, and as a sort of starting point for initiating a discussion between a clinician and a member of the public, I think this is a great way to start to introduce the notion of an advanced nurse practitioner.
Yeah, that's really helpful. And we had a similar discussion earlier. So when we started this work, we started asking each other, well, what do you tell patients when you introduce yourself to patients? And most nurses and midwives that are practicing as advanced practitioners said, well, it's exactly what I tell my patients so that they can understand in easy terms. So we did have a lot of pushback initially that it didn't kind of, as I said, it didn't bring out the key things that professionals would like to see in a definition, but it does what it says on the tin, doesn't it? It's really helpful in explaining the role to members of the public. I think it's been really helpful, Sanjiv, to have your take on this, on the principles and the work that we're doing. So I'd just like to say thank you for joining me and being willing to share those thoughts and reflections with us. And I hope that you'll continue to engage with us as we progress further work on developing those additional parts to additional regulation. So thank you.
You're very welcome, and best of luck with this work. I think it's important work.
Thank you.